At the Elite MD. You ready, Maria?
With the double D. I'm really nervous. This is Sasha. I'm hella nervous right now. My hands just started sweating. So I'm here and I'm gonna get my lips done. What do you think about me getting them done?
You should zoom into your lips right now. This is the before.
Well, right now I have them like overlined. So I try to film an overlining video to like show them how I used to do them before this, and I wasn't recording. And then I had to go pick you up.
Fail.
Yeah, it was a huge fail. Like I was like, okay, I'm done, and I clicked the like red button, and then it started like
recording.
Going 1, 2, 3, and I was like,
wow.
Yeah, it was a big fail. All right, let's go in.
Let's see how this goes.
Okay, so it turned out that I came to the wrong location. They have 3 locations, so just make sure that when you're making your appointment, they tell you what location it is, because in the email, this was the location. So I was just saying that like I feel a little bit embarrassed to tell people like that I'm doing this, because I feel like it's like hella like fake. I don't know. Like I like to tell people like, oh, like I'm natural. And they're like, yeah, we can tell. But I don't know. I just feel like awkward about it. Like I feel like it's lightweight, like something that I have to announce, but at the same time it's like nobody's business.
Right. Like,
you know?
Who cares?
Right. Like it's me, it's my body, it's my money. Like it's what I felt like doing. Like sometimes I don't like how my lips look in certain angles. Like sometimes they have like dents in them and stuff. And then also like I usually overline my lips, and yes, I could keep doing that, but I like how they look that way, and I want them to look like that, like without lipstick on and lip liner.
Right.
You get it?
Yeah.
You get what I'm saying? Like I feel like it's like you said, it's not a big deal.
It's
like,
not. I mean, I want to
do
get mine done. I have no lips compared to her. Okay, like.
And I'm so nervous. You can cut off hair and it'll grow back.
Right.
You can dye it, mess up, you know, your hair, dyeing it a messed up color, but you can always dye it black or brown or whatever.
Do not use fucking box dyes. Yo, I'm a hairdresser.
My gosh.
No, thank you.
Why shouldn't they?
Because that's hella fucking hard to take out. Okay, say for example, like right now you have dark
Record
ass.
yourself.
Oh.
She's just good for hair, guys, not recording.
Yeah. A little bit. I'm still learning. I swear, like, I've had situations where girls, like, will literally dye their hair hella fucking black, or brown, whatever, or red. Red is the hardest fucking color, I swear, to take out.
I heard red is harder than black.
It's, like, really hard. There was this one time. Well, that's because her ass. Okay, so I did this other girl I used to work with, right? She had, like, 10 million colors in her hair. Like, literally. She wanted to go blonde. She was like, use 40 volume. 40 volume is fucking high.
Yeah, isn't that the highest?
In Mexico, they have 50, 70s, and all that shit. But we're not in Mexico. That's the highest volume, and that shit will fucking fuck you up. And I'm slow at my work sometimes, you know? Like, I like to take my time, which can be a good thing or it can be a bad thing. In that situation, she wanted to use 40, so I used 40. Mind you, she has hella fucking hair. I went in and did her shit, and then she went blonde, looked cute, but it damaged the fuck out of her hair.
Did you have to cut it?
She had to cut it. She lasted like maybe like 3 months.
Oh, without cutting it?
Yeah.
Like with keeping the color?
Yeah, so the thing about it is that like her hair turned basically like it's a cute little area, all the trees and shit. You hear the birds.
The woman that's gonna do my lips, she's like the head one, like
The main bitch.
I hope she doesn't do this.
Oops. No disrespect, no disrespect, no disrespect. So that's the main. Elite MD level 4.
You're good at this, Sasha.
I'm just going with the flow. Nah. Okay, how you feeling now?
Oh, I'm still nervous. I'm like sweating.
Let's see your hands. They're okay.
I already know what's gonna happen. She's gonna be like, hi, nice to meet you. And I'll be like, my hands are sweaty.
I like to shake hands. Give hugs.
Give hugs, not drugs.
Give hugs, not drugs. That's her little thing. 450. I need to hydrate because yesterday, you know, was a little turn up by myself. Somebody's here. They're back. Oh, shit.
Hi. I'm Maria. For one.
Okay. Yeah. I just checked in and I haven't even get you started on some people.
I really need to hurt my hands though.
Gentle next throat. Got no back hairs no more.
We usually do pictures for every patient that does any filler, Botox, anything. So if you don't mind, I'm gonna actually have you come stand right here with this being the background for us.
my lipstick?
It's actually probably a good idea. Let me give you a makeup wipe.
I overline them, but not too much. They're gonna be like, is this the after or the before? Because I don't feel like my lips are that small.
They're not. I'm like, I have no.
Mine, I don't know lips either.
So really what's going on is just like sometimes when I speak, one lip is kind of higher when I'm speaking than the other. And also I think it's the same side. When I turn to an angle, like I've noticed I have an indent. It feels like it's not as thick as the other side. But I think it's because I fell on my face when I was a kid. I was like bleeding and stuff, so yeah, I don't know.
Okay, I'll be right back.
Thanks.
You're welcome.
Hi, Maria.
Hi,
How are you? Nice to meet you. Dr. Sonia. It's your first time getting this done, I heard. Oh my gosh.
I'm really nervous.
What are you most nervous about?
Just about the results. I'm really good with like needles and stuff like that. Like when I get my blood drawn and stuff, I like to like see it. Like I'm totally fine. I'm not squeamish. It's just the results that I'm nervous about.
Yeah, I understand. So you're fine with the pain tolerance, which is good. Tell me exactly what you're looking for as far as the results.
I feel like one lip is straighter than the other, like one is a little bit more curved. All around I just want like a natural look and just a little bit fuller, like a little bit poutier. I do tend to overdraw my lips.
And how long have you been thinking about this?
Maybe like a few months.
Okay.
But I just never really like considered it because I didn't really find somebody that I trusted enough. So after you came recommended, I was like, okay.
Oh, well, thank you.
Yeah.
Well, lips are really, they're fun to do for sure. And a lot of my younger patients come to get it done for a wide variety of different results. Most of them are coming more for that fuller lip, and some will ask for that Kylie lip. But we want to be very careful to keep it as natural as possible. So that's really important to me.
I'm not looking for Kylie Jenner.
Right, but some people are.
Yeah, no, I don't want that. That's what I'm trying to avoid.
Yes, good.
Okay, so we're on the same page about that.
Yes. All right, well, let's take a look together.
And also no like duck.
No duck lips. Yes, I don't want duck lips. So usually it's because people have overfilled.
Oh, okay.
And they're putting it in, areas where they shouldn't be, where they're overfilling more in the lining, the vermilion borders. We want to avoid that for
that's
sure.
what my friend said.
We want to be very conservative and just work very slowly with how we work with your lips. So I always like to take a look together with the mirror to just kind of highlight the things that you're seeing and what I can help you out with. So tell me what really bothers you when you look at your lips now.
This one is more like curved here, and then this one is straighter.
Okay.
I do like my Cupid's bow. I've seen that some people do like ask for it to be like
you have a very nice Cupid's bow.
But I want to keep it. Also, I've noticed lately, like at least when I'm in the car when there is shade, like my lips, they do kind of like pop out a little bit. So I don't want to accentuate it more, just because I feel like that might make it look a little more quacky.
Okay.
Yeah.
Quacky. Very natural. No duck lips, no quack lips. Okay. So this is a little bit more fuller, you're saying.
Yeah.
And this one is not as full. So you want them to be more symmetrical?
Yes.
Okay.
Do you think my top lip is bigger or my bottom?
So there is a ratio that we look for. There's a certain ratio where it's not equal, right? So the bottom lip is actually fuller than your top lip.
Oh, okay.
So for you, I would put a little bit more into the bottom lip if you wanted to kind of help with that ratio. So it looks more natural, more harmonized. But at the same time, there are people that prefer having the top lip larger. So it's really a matter of preference and what your goals are.
Okay. I have photographs of like how I overline my lips. Would that be helpful?
Yeah, I can take a look.
Okay.
Yeah, of course.
Because I mean, that's like the closest that I can go to describing.
Okay.
I think.
Pictures are always good.
Typically, this is how I do my lips.
Yeah, so you overline down here, and even in the top too.
Yeah, like you can see my lip right there, but like the liner is like above it.
Got it. Okay. All right, we can just make that a little bit fuller, and we'll try to make the top lip a little bit more symmetrical.
I have like this indent here, like when I go to the side. Will the filler help with that?
Yeah, what happened there?
I did like fall on like my face when I was like younger, like I was like bleeding, so like my teeth like hit like inside of my lip, but that was like a long time ago, so I don't know if that caused
you can see it in
or
here, but I don't see it here. Like right now, I don't see. Let me see. Well, actually, with the mirror. Oh, here. Take a look and see if you see it right now.
Like I think it's just like right here.
Yeah.
And then also I was letting her know that when I speak, sometimes I speak a lot like with one side higher than the other.
Yeah, and some of that is just your natural characteristic, and it's almost like having a beauty mark here, but it's just your characteristic, and that's kind of the characteristic of how you talk, the expressions.
Okay.
And some of the beauty in this is that maybe one lip does go a little higher than the other, but that's just kind of that's what makes you you. So what we'll do is we'll kind of make that a little more symmetrical, but some of that will just be kind of muscle movement. It's more of a muscle issue.
Yeah.
And you may still have that, but my goal is to kind of make everything harmonized. And so hearing on, you know, what bothers you, that's what I'm going to go for. So trying to make this more symmetrical, making the lower lip a little bit more fuller, and then seeing on the left side if I can help with that little area of indentation. So you've never tried any fillers, but you've heard about some of them?
I've heard about like Juvederm, XD, or I don't know if I'm thinking about a TV.
There's a lot of them. So
Yes.
there's Juvederm and Restylane are the ones that are very well known, but there's also another class of fillers. When you look at Restylane, there's also Restylane Lift and Restylane Refine and Restylane Define. So there's a whole family of fillers just in the Restylane category, and there's a whole family of fillers in the Juvederm category. So it just has to do with molecule size, particles, integration of the tissue and the lips. The lips are the thinnest skin also, so you do want to be aware that there's going to be bruising, there's going to be some swelling. Hopefully you don't have a big event coming up in the near, like this weekend or something. Generally the people that do the fillers, I always counsel about that, but people tend to do just fine. I try to go very slow with my injection technique. I try to do a lot of ice and just try to help minimizing the pain and bleeding risk. The other thing that can help is if you stay off of blood thinners. So blood thinners could be aspirin or over-the-counter like anti-inflammatories like Aleve or Motrin. Have you taken any in the past few days?
No.
Okay, that helps. Alcohol is another blood thinner people don't think about. Fish oil is another big blood thinner that a lot of people will take on a daily basis. So have you any of those?
No.
Okay, so that does help minimize the bruising, and so you want to stay off it for the next couple of days. After you're done, so it'll actually look pretty good, but it'll be swollen when you leave today. You may have a little bit of bruising that may start, or you may notice it later in the day. Over the next 48 hours, the swelling should subside. A lot of times people say, oh, I like the swelling, it looks great, and then it's like it starts to go away, they're like, oh, what happened to it? But we like to work also conservatively, so we like to do one syringe at a time. We don't want to overfill or overstretch the skin. So I would say we would start with one syringe, and then if you like it, great, and we could be done. Or if you wanted to kind of work in stages, then you could also do another filler. If you're like, oh, I like this, but I want a little more fullness, or what else can we do? Then I would see you back in 2 weeks, and we would talk more about that. But generally, people do great with one filler.
Do some of them last longer than others?
The ones that we would do for the lip, they all last up to a year. There are other fillers that we use that can last 2 years, even 5 years, but we wouldn't do it for the lip area. So the safest ones are going to be the hyaluronic acid based ones, which last up to a year. The hyaluronic acid essentially is, it's like a sponge, so it absorbs water around it. So the whole way that it's working is it plumps up the skin. So by plumping it up, you have a more fuller lip.
Okay.
And then as time goes on, the product is getting degraded. And so with areas with like muscle movement, a lot of, expressions, it can go away a little faster than a year.
Oh, okay.
So that's why I say 6 to 9 months is a good rule of thumb. Come back then, let's see how you're doing. And if you got some filler in there, we just basically work with the filler and just kind of touch that up.
Oh, okay. Yeah. We'll probably talk about this after, but just like aftercare and
Yes, yeah, we'll go over that when we're done, and I'll have a handout for you that'll go over everything, and a lot of it will be just avoiding any strenuous activity, avoiding any massage to the area, just taking it easy today, avoiding anything that's going to cause more increased bruising risk, so all the medicines I told you to stay away from. You can take arnica or vitamin K topically, or pineapple juice. Those things can decrease bruising. So remember, bruising is the highest risk in the lip area. So
and you just put the pineapple in there, or
so
like
no,
drink
you
it?
eat it. You eat it. You can eat it, drink it. Yeah.
I don't know.
So you eat pineapples and drink pineapple juice, or over the counter they have bromelain. So bromelain is an enzyme that's found naturally in pineapples, and you can take that orally, and that'll decrease the net amount of time of bruising.
Okay.
So if that's something you want to do in addition. Okay. Well, are you excited?
I'm excited, but I'm really nervous. I'm not worried about the pain at all.
Okay.
No, it really is just like the after. Like is this my face?
I know, right? Yes. Well, what we'll do is we'll do a little bit at a time. You can see how it's going in the mirror. I always like to do like almost like a half and half, and like, can see where the results are going, and then we can kind of tweak things if you want to. So it's very much your input along with what I'm doing. So I always like to show that half and half, and then we do the other side.
Well, I definitely trust you because, like, I mean, I know nothing about this. I mean, I'm not a doctor, so I mean, even if I'm like, oh, more here, like, definitely tell me, like, oh, I don't think we should because it's not gonna look right. Or something.
I'll definitely voice my opinion. Okay, all right. Okay, let me get some things ready for you, and we'll get some paperwork. We'll also get a consent release too. She okay? She okay? You're getting all of her expressions.
Yeah. So Dr. Sonia is about to go over the different types of lip fillers that you can get.
So lip fillers, we want to stay with hyaluronic acid base, right? Because it's very natural. We don't want to do things like Radiesse, which is more calcium based, and other fillers that are not hyaluronic acid based. Why are we choosing hyaluronic acid? It's really the most natural. The ones that I like to stick with, Volbella is a great one that's in the kind of that Botox family, the Juvederm family. I really love it because it's a good kind of entry point, a little baby step for people who are like considering lip fillers, but they don't want that. They're really scared about the duck look. They're really scared about like what the outcome is going to be. They don't want to look unnatural. So it just creates that soft, pillowy kind of effect on the lip, which is very natural. The next step up after that is a Restylane or Juvederm, which again for me it's Coke and Pepsi. You know, whatever patients prefer or whatever I've got, I'll kind of go with because I like both of them very equally. Restylane or Juvederm is kind of the next step up. It'll just give you a little bit more of that fullness, more of that water attraction effect. The Lift and Juvederm Ultra Plus will give you even more of that effect of the fullness. And then I like Restylane Define because it's great for integrating in tissue where you have a lot of movement. So for the lips would be really great as well. So all last about a year, all have pretty similar side effect profiles. But I think in you, because you want a very natural sterning filler, we're gonna go with one of these.
Okay.
All right? Okay, I'm excited.
How long does the process usually take?
Well, with the numbing sitting on, it depends. Everybody's different. Like somebody after having the numbing on might have it for like 5 minutes and just say, okay, I'm just ready to just do it. The person that has it done all the time and they're just coming to do it again, like 10, 15 minutes.
Okay.
But with somebody that's she's going to take her time and show you how it's going in between and half, maybe half an hour, 50 minutes. Just try not to. I'm like trying not to talk as much as possible with it on because there's more chance of it getting in your mouth and it's not going to taste good. And of course it's topical numbing, so it could, you'll just feel the numbness on your tongue. So when it sits on, it gets like a little, it warms up and it kind of liquefies a tiny bit, like it'll become like shiny and a little bit.
Oh, it works right away. Is it true that the numbing cream plumps up your lips a little bit too? I've heard that from someone else I got their lips.
People might think that it's pumping them up, but it kind of just gives them more color. So they kind of stand out a little bit.
Hi, how are you? Do you know Jeffrey's son? Okay, so we're gonna be going with Volbella.
You have like one white spot.
Oh, right in the, no, I'm not gonna touch it. My tongue is like now.
Don't touch your lips.
Oh, I didn't. Oh, now.
Yeah.
Okay.
You just did.
Did I? I can't feel it. I feel like I'm talking weird. My lips feel crusty. They feel crusty and I feel like
squeezing.
Like I've been in the desert for a very long time. I'm gonna go with Volbella because I feel like I don't hear about it much. Also, it's like the newer version of Juvederm. Sasha, can you let them know because it seems like you understood it more. I think I'm just so like nervous, like I caught every other word.
What I understood was definitely like the Juvederm. A lot of people get. It's more well known. And then like the Volbella is always like it's in the Juvederm family, but it's just newer. And they're both softer. They're both like that natural kind of thing because they're lighter. What is it called? What is
Thinner.
Thinner.
They're both thinner.
They're both thinner.
Yeah. And they were also saying that with the Volbella, like it's more like she was saying like a plumper. Like it gives you like that natural. Yeah. So she really talked this one up, and I'm like, you sold me.
I would do it.
I think my lips look swollen right now. No.
A little bit.
Right?
They look bigger.
Like, all right, cool. I just want that. I just give me the numbing cream. We good. Okay, so this is what my after is gonna look like.
Alright, so I'm going to wipe it off first, and then I am going to go ahead and alcohol around your lips before she injects. And this looks like you have lip gloss on.
That's so weird. I feel like, am I drooling on you?
No.
Okay. I don't know. I can't control it. I feel like, just in case. Just in case. I don't know. I look crusty like that.
Oh.
Oh, the makeup?
Am I smiling? I can't feel my lips.
I just finished the makeup off around your lips.
Oh, wow. I look crazy. Can you see?
Oh my goodness.
I didn't even bring makeup to put on. Yeah.
That's like a buddy. It's like literally a whole circle.
I know.
It's okay. You could just probably like.
Like even it out.
Yeah. Like, you know.
Exactly.
I might need a makeup wipe to go. Do that. Have school later.
I'm gonna do a little video. Is that okay?
Yeah.
Okay, cool.
I look a little crazy now because
Hey guys, it's Dr. Sonia, the lead MD. So today we are with this beautiful patient of ours who's got beautiful features, and she just wants to help touch up the lip area, just give a little pout. So we have chosen Volbella today. I love Volbella because it's a great hyaluronic acid filler that'll just give a very soft, very natural, very pillowy, cushioned look to the lip. So it'll be like almost like wearing lip gloss on the lip. So it'll be very natural, and I think that's the biggest thing that people worry about is having unnatural big duck lips, and we don't want to go there. So this will be a very natural product to use. To hold on to these guys. Let's keep the in there. And and we're going to get some ice going in the meantime. Okay. So you're going to hold on to the ice and just put it on your lip. That'll actually help constrict some of the blood vessels for me.
We can't feel it.
That's good. That's a good sign. It's getting numb. Just a little alcohol one more time. This is another thing that does help is having a little vibration. So some people will actually just tap on the skin, and that kind of helps to kind of distract the nerve endings a little bit. So the same kind of thing with this tool is we'll put it against your skin, so it'll be like a vibration. So your nerves will think, oh, let me pay attention more to that vibration that's going on instead of this needle inside me.
Only thing is she's gonna see me recording and her.
Oh, that should be okay.
That's okay.
Don't know it's real.
Okay, so just to kind of walk through it, I'm going to go ahead and probably line the area of what we call the vermilion border. So the vermilion border is the outer part of the lip, and she's got wonderful, beautiful shape. So we're going to just outline very, very subtle. And then most of the product is going to end up actually being right in the meat of the lip, right in here. She's got a beautiful cupid's bow, so we're not going to really touch that. And then we're going to put some right into the meat of the lower lip. So it'll look really nice and natural and beautiful. And here we go. Get yourself prepared. Your job is to close your eyes and just kind of go into the world. All right, count of 3. 1, 2, 3. Okay? Good. A little higher up. 1, 2, 3. Okay, stuff. So far, so good?
Yeah, it just feels like a little bit of tugging, like at your lip.
Okay, good.
Yeah.
I'm going to go just in your natural cupid's bow, okay? I'm not going to do anything more than just going to follow it along with a little droplet. So we're going to go right into the meat of the lip next. 1, 2, 3. Okay, good. Doing really good. So we're just a little over half, but I want you to take a peek at it, just see how natural it's looking so far.
Oh wow, yeah, it looks really natural.
This is good to actually get the
My first
response. Yeah, do it again. Ready? finished doing the vermilion border in here, and I always like to have patients do a half and half, and we put a little bit in the meat of the lip on this side, and we actually haven't done this side just yet. So I wanted to take a look in the mirror, and
okay. Yeah, it looks really natural.
and she
Like,
didn't
it looks
really
good.
didn't even bleed much, so I don't even think she's gonna bruise much. So
And I didn't feel it.
Oh, good,
Also,
good.
yeah, like you were saying 1, 2, 3, but I was gonna say just
go.
do it. Yeah,
Yes.
just go.
That's what we want. Okay,
Yeah.
awesome. It's doing really great and very natural. So far so good. We're gonna do the same thing on the other side, okay?
I'm excited.
Okay, me too.
Yeah.
Keep some ice on there for me.
I can't even tell right now.
Yeah, I mean, she didn't even bleed at all, which is really good news. Okay. 1, 2, and 3. This is where she has that little defect right in there, so I'm putting a little bit extra in there. Okay, I like to massage it in and make sure it feels nice and smooth. Okay, we're going to pause for just a second. I'm going to go ahead and massage. So we're just trying to help with smoothing it out, making sure not feeling anything. Now it's going to be normal to feel maybe some little lumpiness possibly throughout the day, because as you move, sometimes the product also likes to move, and that's normal. It should all, again, it's going to all kind of settle into place over 2 weeks.
Okay.
That's kind of funny.
What?
How you live?
All I'm thinking is like, can I eat a burger? It's just soothing. Like I don't feel anything.
That's good. Okay, let's just take a look together in the mirror again.
Oh, I see it now.
You see it? You can definitely see it.
Oh yeah.
It's so good.
Yeah.
I like it. I'm liking it.
It looks good. They look more symmetrical now.
Yeah, I definitely put more product on this side to try to even that out a little bit. Trying to kind of keep it symmetrical, but massaging it right after that too to kind of make sure that everything feels smooth in there. So far so good. I've got a little bit left. Do you have a preference of where I put it?
I would say.
I would say like where? Like in the bottom? Like bottom center area?
Yeah, that's what I would shoot for too.
Yeah.
Here's the other thing we could do. We could put a little tiny bit right there to kind of give you an upward shape here. So if it goes downward, you actually have a nice upward shape already, but if you want it to be a little bit more, we can kind of put a little, almost a little buttress of filler to kind of, it's like a little mattress, so it sets this way. So instead of having a downward lip, you'd have an upward lip. But we don't need it in you.
I think my downward lip is good.
Yeah, I think you're good too. I think so too. See, one area that is a little more scar-like.
Yeah.
I can tell. It's not like the same kind of skin as the other areas are. There's a little area I want to just touch up on here. Yeah, she's like kissing my little glass. She's cute. Okay, good. Yeah, everything went beautifully. Just that one area where you have a little extra scar tissue, see how that does? It may actually bunch up into that area because it's just a little different skin. So if that happens, you can actually just massage that a little bit just in that area if you need to. Okay? Right now it's swollen, but I could tell when I was going in there that it's a little bit more thinner skin, a little bit more scar tissue in there. So it might react a little differently. And so your job is just to maybe keep an extra little bit of pressure to help with the swelling. And a lot of ice for sure.
And it's just over like that little bump area? Okay.
So let me have you take a look at your final results.
They look good.
I know.
Yeah.
It looks so good. And you didn't bleed. Like, I don't even have to clean you up. You didn't even bleed. It looks so good. Good job. So cute. Good job to the lips, right?
Yeah.
High five.
And you
No, high five to the lips.
Really
Your lips were easy.
Teamwork.
That makes the dream work. Okay, let's do a quick video at the end and see how she did then. So, you comfortable talking?
Yeah.
And let them know your experience, how bad it was in terms of pain, or like how you feel about your lips right after the fact.
Do you want to, because I don't want to freak anybody out on your like Instagram or anything, do you want to like maybe do it from a different angle for the like bump?
Sure. You want to do it from this angle?
Because I want them to know, like, you did a good job.
Yeah.
It's just my lip. It's, like,
I know.
it's just my lip.
Yes, and I'll tell them actually. 1, 2, 3. So we just finished up with Maria. She did awesome. Like, she is one of my best patients. She barely felt it. It seemed like she barely flinched. We were able to do a full syringe of Volubella very, very efficiently in her border, as well as on the meat of her top and bottom layer of her lip. So how are you feeling, Maria?
Oh, I'm feeling numb. I don't feel anything. I'm just so excited and like happy that it came out like great. I didn't feel really anything. It just like a little bit of tugging, but nothing.
Awesome. So when you're nervous about the outcome and the goal, you good now?
Yes, I wasn't nervous about the needles. I was just nervous about the outcome, but I mean, they look good. And we used the full syringe like you said. So yeah, I would say do it.
Yeah, she's so sweet. So Volubella is the best, like, easy baby filler to start with because you really can't go wrong with it. It's a great hyaluronic acid, and I just knew that she would do really, really well with it. And this is even the final result. So right now it's actually going to be looking a little bit more on the swollen end today, and she's going to ice up over the next 48 hours, but everything's going to settle down over the next couple of weeks. Her job is just to kind of take it easy and not to really massage or anything like that, but just a lot of ice for the next couple of days, and everything should settle out very, very quickly. And then she can be enjoying her new lips.
I'm already enjoying them.
And she has a birthday coming up, so she can really enjoy it on our cruise. All right, thank you.
Thanks.
All right, you did awesome.
Thank you.
I'm so
Thank you.
excited.
Sorry, I'm so kind of cold.
No, you're good. You're not so sweaty anymore. All right, let's do an after picture. And that's great because you can see the before and the after right away, which is so cool.
Okay, so I do have a little bit of like scarring tissue like I thought I had. So it did like swell up a little bit, like right here. But she said it's okay to rub it down. Other parts I'm not gonna even touch because I wanted to stay in the places that she originally did it. It's just right here. She said I can just like massage it down. That the scarring does make it like work a little bit different, I guess, in that area. So yeah, I should be good though. It is 24 hours after the like little bump that I had. It's a little bruised now. And yeah, I don't have anything on my lips right now. This side is like perfect. This, like, I'm good. Like yes, like that's it. And then once this goes away, I'm pretty sure it's gonna look like symmetrical to this side. I think it's just more swollen because again, I was messing with this side. Don't do that. But yeah, like yes, like I don't know. I just look like just the way that I don't know. I just think they look so good. Really, where is pineapple at? So there's tropical, there's pineapple orange, there's pineapple orange banana. Oh, see, no, just pineapple. Okay, so I guess the best I can do is mango pineapple. So I'm gonna be halfway unswollen. It's good. So this is my version of icing. Okay, so this is my first time lining my lips and putting on lipstick since I got them done. It was super easy. I didn't have to make sure that each side was even because they already are even, so all I had to do was line them. I got them done on Tuesday. Today is Saturday. It's been a few days. I have to wait 2 weeks for them to be completely done. The left side still might be a little bit more swollen than the right. I'm loving the results, and it was the quickest I've ever done my lips for sure. So it's been 3 weeks and my lips look like this. I still have a bump there and lightweight a bump there. So I'm icing. Okay guys, so I want this video to be as honest and real as possible. I am going back to Dr. Sonia. My lips are healing a little strangely. I do have again some scarring tissue in my lips, so she had warned me that the healing, you know, might be a little bit different for me. and that's what it is. I'm gonna see what she recommends to me today. This is what they look like right now. I still have a little bit of a bump at the top, and over here it just looks a little bit odd at the bottom. We're gonna see what she recommends me to do, because I'm just not feeling it. It makes me feel self-conscious, and I feel weird when I'm talking to people. I feel like I have to talk to them kind of like this and not open my mouth up, because if I do, then it's kind of like you see the bump more. Yeah, that's just me being honest. Maybe even it out, put like maybe some more filler. I'm not sure what exactly are my options. I'm gonna figure it out now. This is what I look like right now. So we decided that we're gonna go in with the hyaluronidase, which is going to dissolve where I need it. And we didn't decide to go with more because we don't know how the scar tissue is gonna react with more, and also it's gonna make your lips bigger, so then it's kind of like you would have to add it to everywhere. So instead she's gonna just do conservative little drops of hyaluronidase, and then we'll do some tweaks as needed. Wet n Wild sponsor Dr. Sonia. All right, so we did like 4 little pokes. So honestly, the hyaluronidase hurt. I would say like it hurt more, but I mean technically yes, it did hurt more than getting the filler, but the filler didn't hurt, so it's just kind of like, I don't know really how to say it. It hurt more. It just simply that it hurt. It like kind of felt like when you get your nose pierced, kind of like it gives you kind of like that oof feeling. You can't feel the needle, it's really just the product that you're feeling. That should solve my issue. I just didn't like the fact that my lip looked kind of like it was hanging a little bit. I mean, if both of them were matched up, then girl, it could be a look, but it wasn't. And then this side was a little bit more plumped up than this side, and then it was also making my outer edge look thinner. It was just not looking smooth as Dr. Sonia described it. It should be all fixed now. By the way, if you guys are curious, she did say that I should see results within the next 72 hours, so do expect to get an update on that stuff. I want this video to be very informative, very realistic, not just oh, look at me getting poked. I've seen so many videos like that where it's just these girls getting injected, them sitting in their cars, and then being like, oh, so this is what my lips look like after. It's like, okay, what do they look like in a week from now? What do they look like in 2 weeks from now? Because I'm curious. When I got mine done right after, they looked hella good. Like, what the hell? But you know, everybody heals differently. Again, I am gonna be that one for you guys. I'm gonna show you the real. I think someone who made a really good video and set really great expectations is Amanda Ensing with Dr. I believe it's F.Y.I. I'll link her video in the description, but she made a really great video on getting her lips done, and she was the first person to really put it in your head that you may need to see the doctor after getting your lips done. You may need to have some tweaks done. It doesn't always come out perfect the first time. Also, she is the first one that let me know about hyaluronidase, getting your lips dissolved, because that's what she was doing. She got her lips dissolved, and then she just went to this doctor for them from now on. She did a great job, that doctor. I think Dr. Sonia, she's great as well. It's just that my lips, they have scarring in them. I've had braces, and you know, I've fallen on my face. I've been bitten by a dog on my lip. Like, it's just I have issues. So yeah, that's it is what it is, and I wanted to show you guys. So it's already been 3 hours, and I can already see that this lip has gone down because my teeth are showing more right here, and I'm not picking up. This is it relaxed like this. So yeah, I can actually see my tooth poking out, whereas before I couldn't. The bottom one still looks swollen. There's still that bump there, but again, this is just 3 hours after. I just wanted to show you guys how quick it works. Okay, so currently I am procrastinating to go into the gym. So I decided to vlog an update on my lips. So it is more rounded out. Definitely it is not as high up as it once was. This part is still a little bit lower than this part over here. It looks smoother on my top lip and smoother on my lower as well. So the left side, you can still see the bump, but the right side is definitely obviously smooth, and I look like a... As far as the bottom, looks pretty evened out to me, besides this left side being lower right here. Tomorrow it'll be 3 days, so right now we are looking at 48 hours post hyaluronidase. Need to go to the gym. So the person that did my lips is on TV. Eight.